Hello, good morning, everyone at Healthy Living OKC. Thank you so much for joining us today. Today, we're really lucky to have Dr. Stephen A. Crawford here. He's the Senior Associate Dean at OU College of Medicine. So today, he's going to talk a little bit about influenza. It looks, based on what I saw, we're going to cover a little bit about the past of the history of flu, how we got here, vaccines, and what you can do to make sure you're protecting yourself and your family. So we'll go ahead and bring Dr. Crawford in here, and he's going to go ahead and get started. So thanks for joining us today. Oh, and one more thing, we'll do questions at the end, so make sure to put your questions below. So thank you.
Thank you very much, Stephanie. I really appreciate being here to talk with everyone. As you see, we are wearing masks in between. I'm going to take it off now because I know some people can't hear as well and want to be able to see my lips. My father, who's 99, has a challenge, and he does use lip reading even with hearing aids. So I really appreciate the opportunity to be here to talk about this very important subject. I'm going to switch over to our slide show now. Get it up. See if I've got that's right. Thank you very much, Stephanie. All right, so what I'm talking about is influenza. What's the big deal? And this looks very familiar nowadays, what we're now in the midst of, wearing a mask. But this was in 1918, during what many know as the Spanish flu or the flu pandemic of 1917 to 1919. And unfortunately, we're now going through something very similar. Stores were closed, like this slide shows. There was concern, obviously, with influenza causing pneumonias and many people dying in many cities around the United States and actually, unfortunately, around the world. They ran out of hospital beds, and they had to set up camps like this as hospitals in many areas of our country. They did it also within big gyms, and we've seen this, unfortunately, during this pandemic. And the issue is this was influenza, not COVID. And we're now getting into the influenza season. And this is the concern that many healthcare providers now have regarding what may happen if we don't take the appropriate precautions at this point, and the things we know we can do. So again, the influenza virus is transmitted very much like the COVID virus is. Coughing, as you can see, this is a simulation of a young person coughing and what happens with the spray of that. And that's the reason why when we're not socially distanced or when we're with others in the public, we want to wear masks. We do know that masks, even the small surgical mask or the thinner surgical mask compared to the N95s, do help prevent that particular spread. So that's very critical. The picture next to it is of young children. First, we thought children were relatively well protected and wouldn't get infected with the COVID virus, and we do know they get the flu virus and do transmit that to our homes and into our schools, and from schools back to the home and then to their parents or grandparents who may be living with them. It's also not as readily transmitted by contact, but that still is a concern. And kiddos like to play and they touch each other, so it's very critical that we take appropriate precautions and help prevent all of us from getting the flu this year. This is a particular significant graphical representation of the significant impact that the flu pandemic in 1918, 1919 had, because it hit the younger population very significantly and actually caused a significant drop during that period of time in life expectancy. You can see that we've had a gradual increase since 1900, mainly borne by safe water, immunizations, and other healthcare measures. But those other two were primarily due to those safe water and immunizations really caused the increase in life expectancy. But we didn't have a vaccine in 1918, 1919 for the pandemic flu. Actually, we didn't know we knew a name for it because there was a disease that was like that you could recognize that happened that time of the year, but we actually didn't know that the flu was caused by the flu virus. There was all kinds of conjectures. It wasn't until the early 1930s that we actually the scientists determined that it was due to a separate virus called the influenza virus. But it did obviously cause a significant downturn in the life expectancy. It did get better, obviously. We resolved it, but we resolved it because I think primarily the World War I ended, and that's where it got transmitted all over the world very quickly. Nowadays we have, and that was due to a lot of public world travel, be it by soldiers. We now have world travel not by soldiers as much as by others, and that's what unfortunately led to the spread so rapidly and quickly, and is continuing that spread because unfortunately folks aren't following good public health guidelines. The 3 W's: wear a mask, be with farther than 6 feet distance, and wash your hands. Those are the three very important things to do to prevent it. So wearing masks. Now, there is a fourth thing that I would recommend, and again, I want to emphasize why influenza is such a big deal. In the United States, this is just in the United States, it causes a huge economic impact, up to $5 billion a year, up to 30 to 60 million infections and other illnesses. You know that if you get the flu and you have a risk of heart disease, you have a higher risk of having a heart attack when you get the flu than those that don't. So the flu doesn't only cause a flu that you feel achy and get a cough, but you can also have problems associated with like heart attacks and strokes. People who have diabetes, their diabetes can go out of control. Women who are pregnant could have premature labor or miscarriages. So it's very, very critical that all of us take this disease seriously. It obviously causes a large number of physician visits, hospitalizations, and even up to nearly 60,000 deaths per year. Again, we're way over that on the COVID issue, but we don't want to increase that if we can by doing appropriate precautions. So what do? Well, first of all, we have to understand the virus, and this is kind of a complicated, but everyone hears that there are different letters associated with the flu. There's an A and a B, and actually there are several other letters, but the things that affect humans are the A and B strains of the flu. And then when you may hear that sometimes they're called the Chinese flu or the Hong Kong flu or the swine flu, that type of thing. And that's because where they are originally discovered, that's why they give them a name. And then they have a strain number, the year that particular virus that was discovered. But the other more important thing that you may hear is on the A virus is the particular what are called subtypes. And those have to do with the particular chemicals that surround the flu virus. And those are fancy names, hemagglutinin and neuraminidase. I can say it, neuraminidase. Phew, that was easy for me to say. But that's where you get the H3N2 and H1N1 designation for those. And each year, why those are important is that each year the flu virus changes a little bit. And why we know that is because the flu season in our southern hemisphere happens at 6 months before ours. And we see what's circulating there, and our experts get together, the World Health Organization and the CDC get together and say, this is how these are the particular virus strains we need to put in this year's flu vaccine. And they designate it as we need an A, this particular type H3N2, this particular A H1N1, and usually one or two types of B virus, flu virus vaccines that go in the vaccine to help protect us. They're predicting what may happen, so sometimes they don't always hit exactly, and that's the reason why at times there's what's called a mismatch between the flu virus vaccine and what's happening in the community. But it's the best way we know at this moment to be able to prevent us getting infected from the flu virus and having significant consequences once we do become infected. So what do we do about this? Well, this is one person's, I put this in as a bit of a comedy. This was actually in a pharmacy that they actually had a sign up for flu shots go this way, but it was at the liquor cabinet that this pharmacy also had. And unfortunately, a lot of people during our COVID pandemic are partaking of alcohol to help ease anxiety and other issues. I do want to emphasize that alcohol of any type is not a curative for influenza or COVID. This was just an unfortunate connection that pharmacy had the flu shot sign above their liquor cabinet. And again, as you know, many states do have are able to sell liquor within their pharmacies. Anyway, so for the 2020 and 2021, there are both what are called trivalent or 3-component vaccines, and there are 4-component vaccines, and we'll go over why you do one or the other. But again, there are, as tradition is there's usually composed of 2 A-type flu viruses and 1 B-type they're predicted to be the most common. Because they decided many years ago to make what is called a quadrivalent or a 4-valent vaccine, they've added usually a second B vaccine. And where this is particularly important is in children. The older adults, for whatever reason, don't seem to be getting B as much as the A virus infection. And A viruses usually are more severe than the B virus. And so when they came out with the 4-valent or 4-virus vaccines, they actually brought them out for kids initially. They're now making it for almost everyone, the 4-valent, but there's still some 3-valent or 3-virus vaccines. And as you noticed, I put down that there are egg-based vaccines. I think that's important for everyone to realize that the industry starts vaccine manufacture in about January or February of the year. So the vaccines that are now available started being produced in January or February by chickens laying eggs. And then they take those eggs and inoculate them with the virus and grow the virus in those eggs. And then they take that growth and then modify those to make them into a vaccine. They kill the virus, so it's not, except for one vaccine, they kill the virus and use the chemicals that are part of that to make the vaccine, so your body, your antibodies react against those particular components of the virus to make antibodies, so that when you are exposed to that virus, it knocks it out much quicker. So the issue here is that there are egg-based vaccines are the most common and have been in production since we first developed the vaccine, which was in actually 1945, right around the end of World War II was the very first flu vaccine. Since that time, there's been a lot of development and a lot of improvements in vaccines. And one of the more interesting things that happened relatively recently is there are cell or recombinant-based vaccines. Those are the new biotechnologies to make vaccines, and they've used this particular technique to make other vaccines, but it wasn't until relatively recently that they made flu vaccines with a cell or recombinant-based method. Recombinant is where they use genetic engineering essentially to design the vaccine and make it so that you're not reliant on chickens to produce eggs that then have to grow for a period of time and then do it that way. They actually grow it within cell cultures and within other means that are listed. So they're a little bit different, interestingly, the cell or recombinant-based vaccines, and that's based upon that particular technology. But you see here that we have 2 A's and 2 B's. The only kind that are cell or recombinant are the 4-valent vaccines that are available on the market today. So I do want to make this is a new flu vaccine for those 65 and above, and some may have heard about this. It's called Fluad. And that particular name is significant because it's the first flu vaccine that came out with what's called an adjuvant added to it. Now, this is an egg-based process, how they make it, but they add a particular chemical. As you can see, it's called MF59. It's not a big deal, but it's a type of chemical that's added to some vaccines to enhance or direct the immune response. And why do you need that? Well, in those 65 and older, there are challenges to our immune system. I'm 67, and our immune systems don't react as robustly as when we were younger. And with that, we do know that the older adult has less response to the vaccine and less effectiveness when you get the standard dose vaccine. So pharmaceutical companies were challenged by our scientific advisory boards such as the CDC, the World Health Organization, the NIH, to produce a different kind of a more immunostimulant vaccine. So this is one way that they did this. They added this chemical to this, and it was approved originally. This particular chemical was and vaccine was approved all the way back in 1997 and was approved in up to 38 countries, including Canada and 15 European countries. It took till 2015 for our own FDA to approve this particular vaccine. So should you use this particular vaccine, or should you request it when you go to your pharmacy? Well, there are increased benefits to this particular compared to what's called an unadjuvanted seasonal flu vaccine for this age group. Antibodies levels are comparable to levels induced by the unadjuvanted, again, those that don't have that added chemical to it. But an observational study conducted in Canada among adults 65 and older during the 2011-2012 found that it was significantly more effective in preventing laboratory-confirmed flu compared with the unadjuvanted standard dose. And that's important. I want to make note of the standard dose inactivated flu vaccine. Again, there's the live virus, or what's called flu mist that you may hear about. Again, that's not for those 50 and above, so I'm really not going to talk about that much. And the inactivated, or that's where the virus is killed and you're only using the chemicals. That's why they call it inactivated. So does the Fluad offer better protection than the older vaccine that's for those that are 65 and above, and that's called the high-dose flu vaccine, or Fluzone high dose. That was the first vaccine that was produced, again, at the impetus of the World Health Organization and the CDC to produce a vaccine that, again, provided a more robust response. And as you can tell by the name, what they did was they just increased the amount of antigen or viral chemicals in the vaccine dose that each person would get. And it did show a marked response immunologically, and it was proven in a large study to provide better protection for those 65 and above getting that particular vaccine. There hasn't been, though, to date, any studies that compared Fluad with Fluzone high dose to prevent flu in those 65 and above. And the experts who've reviewed this data at this point don't give any preferential recommendation for one flu vaccine formulation or the other. So at this point, the recommendation I would say is that everyone 65 and above get the Fluad or the Fluzone high dose vaccine if those are available. If for some whatever reason they're not available to you and it's coming up to flu season, which it is at this point, starting really October 1, but really November through the end of February, through even March, you need to consider getting the flu vaccine. Just get one of them. That's really important. But if you have the ability to request one or the other, I would certainly request the high dose Fluzone vaccine or the Fluad, which is the adjuvanted flu vaccine called Fluad. So who are at highest risk, though, of seasonal flu complications? Those 65 and older, again, because of that lower immune response to the flu vaccine partially, but also because of what are called comorbid, or as we get older, we accumulate health risk, whether it be that we've gained too much weight, like many have done, unfortunately, during the pandemic, or because we have other habits that we have created for ourselves, such as diabetes and heart disease and lung disease from inappropriate activities like smoking. And that's why people that who are in chronic care facilities who become debilitated because of their health risk, but also because they're in congregate, meaning they live together and it's easily spread from one person to another in close quarters, very much like COVID unfortunately did in many nursing homes around our state and around the country. And that's the reason why it's important that everyone in chronic care facilities get the flu vaccine. We also want to, even those less than 65, we want to emphasize getting people who have chronic lung metabolic, which is diabetes, really a name for diabetes, or cardiovascular disorders such as congestive heart failure. Those who have renal dysfunction, like who have chronic renal failure or on dialysis. Those who have what are called hemoglobinopathies, that's a fancy name for people who have like sickle cell disease, and a growing number of people who have certain immunosuppression issues, including HIV infections, those who have rheumatologic conditions who are receiving immune modulating medicines, those who've had a transplant for whatever reason, kidney transplant, other types of transplant, who are taking medicines that help suppress the rejection of those. Children less than 6 months of age who can't get the vaccine aren't mentioned here, but those are at particular risk. This is those who could get it 6 months to 18 years of age. But I want to make a point that those children, right now, no flu vaccines approved for those 6 months and younger. So what do we do for them? Well, what we do for them is, one, we do a thing called cocooning. And cocooning means is that everyone around that child needs to be vaccinated for the flu to protect themselves, but also protect that child, because they can't get the flu vaccine, and we don't want to spread it to them because their airways are smaller. If they get the flu, they can get sick very quickly and become severely ill. The other group of people that we sometimes don't think about are pregnant women. Pregnant women are particular risk, particularly later in the stages of their pregnancy, because with a growing uterus, the problem is that the lung doesn't expand as readily. So if they get the flu virus, they're at more risk of developing lung complications from that. The other reason we want to make sure that women get the flu vaccine during pregnancy is that antibodies are passed through the placenta to the developing fetus and protects the fetus once they're born from that problem that we have in that first 6 months of life when children, those 6 months and younger, can't get the flu vaccine because it isn't approved for use in those age groups. So I want to dispel some myths about the flu. First, flu isn't a serious disease. the flu shot can cause the flu, and the flu shot does not work. Those are, again, false. And let me go through each of those. You all saw this, the data on flu isn't a serious disease. Obviously, flu can cause pandemics like it did in 1918, 1919. We've had smaller pandemics over the last 100 years or so, but we've also now in obviously a very serious situation where we have a pandemic, not the flu occurring, but it's a respiratory illness that can cause significant illness, and then you get the flu on top of that, can be very devastating to a person's body, as it were. The flu shot can cause the flu. Absolutely not. The flu shot cannot cause the flu. I'm making that a point. The flu shot can't cause the flu because it's a killed virus vaccine. It's not a live virus vaccine. So some people say, well, I got the flu shot and I got sick. Well, there could be several reasons for that. The first is that the flu shot doesn't work for about 2 weeks in regards to its protection from that. So again, that's why we want you to get it before the flu season. And you could have already been infected with some type of illness when you got the flu shot, and that you just coincide getting, because a lot of respiratory illnesses are happening during this time, including COVID. So you get the flu shot, you get sick, and you blame it on the shot, which wasn't really the reason for the illness. The second is that some people do get a mild immune reaction for several days because your body has good antibodies and responds to the shot by making those antibodies because you have a robust immune system, and it can cause a mild achiness and soreness at the site, and even a low-grade fever for a day or two. That isn't the flu. That's just the mild reaction to the flu shot. That doesn't mean that it's not working. It actually, I think you should say success, because your immune system is responding to it. Now, does the shot work? Well, the thing we do know is that those people who get the flu shot have a much lower risk of getting the flu, but more importantly, have a much less risk of being hospitalized and of dying. Now, it's about, when you look at the effectiveness of those people who get it to those who don't, there is a marked difference in regards to those particular statistics. But if you look at just those who get it, there's probably, depending upon the year, because again, the virus changes every year, and we're guessing what's going to be in the season, the flu season, but it works about 50 to 60% of time of totally preventing the flu. It works much better at preventing death and hospitalization. So that's the issue that you need to be thinking about. It's not that it doesn't work, but sometimes people still get a case, but it lessens the severity of that. So again, the side effects of the vaccine are worse than influenza. I would say, death is a pretty significant side effect, and the risk of death from the vaccine is nearly zero. Only older people need the vaccine. That's not true. We kind of went over all of those that need it earlier, but that's very important. And it says you must get the vaccine before December in order to benefit. And I'm going to say all of these are false. Again, we talked about the side effects are much worse. The older, not just older people need it. But what about this issue of getting it before December? Say you, for whatever reason, you forget to get it. And should I wait, or should I still get it in January or February? I have several reasons I would recommend getting it even late in the season. One, if you've been lucky enough to avoid getting it, it still circulates. The particular flu viruses do circulate actually year-round. We just have a peak during a particular time of the year. The second is you may want to travel, and if you travel to the southern hemisphere, you may be going during their flu season. And the flu vaccine doesn't just work for 2 to 3 months. It actually stimulates the immune system and develops antibodies to those flu viruses. Now, the detectable antibodies do decrease, but that doesn't mean that once you're re-exposed or you're exposed to that particular virus in a natural situation, that your body doesn't suddenly respond because there are memory cells in our body that store this information and help respond. So I tell people, keep getting the vaccine. If we have vaccine available and the person wants it, give it through its expiration date. And I like to tease my residents who I'm teaching, when does our flu vaccine expire every year? It's actually June 30th of every year. It isn't February 1. It isn't March 1. It's actually June 30th. So if we still have flu vaccine and somebody wants to get it, there's no reason not to give it up until June 30th. Now, after that date, you're not to use that particular season's flu because they're producing the new flu vaccines that usually come out actually starting as early as August. And that is a particular point. If you got it early this year, should you get re-immunized? And at this point, the recommendation is not to be re-immunized no matter when you get the vaccine. Now, if you got it incorrectly, if you say you got a dose that hadn't been stored properly, or if you got one that's not for your particular age group, like say for whatever reason you got the flu mist and you're over 65, I would say at that point you should get, when you can, either the standard dose or preferably the high dose or the Fluad if you're over 65. If for some reason you got the flu mist, now why somebody would give you the flu mist that's for those 50 and younger, I don't know, but that could have happened just as a supposition. So protect your kids from the flu. It's very important that they get protected. They're actually the transmitters, unfortunately, the carriers of the flu. And when they're in classrooms, they are very, in schools, you actually see a drop in flu happening at Thanksgiving and particularly around the Christmas holidays. But you see an increase right before that time, and then bam, it goes away. And then when they go back to school after the holidays, you usually see a resurgence of the flu at that time. But it is important so both younger and older people do that and stay healthy by doing activities like these two are doing. I think those are very critical to keep our bodies healthy with good diet, rest, and activity. And it does protect you and your family. Remember that we want to protect all of those. There are a few number of people that shouldn't get the flu vaccine. The first are those who have had an anaphylactic reaction, meaning a severe allergic reaction to eggs. That's one that should not get this. Not if you have kind of a mild tummy upset when you eat eggs. That's actually been shown not to cause any problems for that. The other group are those that have developed a condition called Guillain-Barré syndrome, which is a neurologic condition that has been rarely, and again I emphasize rarely, associated both with the vaccine and with flu infection. I want to emphasize that it's not just the vaccine, but if you get the flu and you've had Guillain-Barré, you're at risk of getting Guillain-Barré again. So what should you do in that situation? I would encourage those people to be cocooned, meaning everyone around them get the flu vaccine to prevent them from getting the flu. And that helps protect them from having a recurrence. For whatever reason, there's certain people that are susceptible neurologically to this particular antigen response. And they think it's an immune type of response to the antigen, so that if you're exposed, whether it's through the vaccine or a natural infection, you're going to be at risk of having a recurrence of the Guillain-Barré syndrome. Staying healthy is important to you, so get your flu shot to protect yourself and the ones you love. And there's a wonderful website. If you're interested in that, you can go to the cdc.gov/flu. It can give you the current status of what's happening in your community even. It gives you the current statistics of what's happening in whether it's active or not. I can tell you right now we're at a relatively low activity in Oklahoma. We're not rampant at this point. It's not. And that's not uncommon. It usually doesn't ramp up in Oklahoma till about January or February in Oklahoma. So we still have some time to see if this will rear its head. There is some good news that in the southern hemisphere, as I mentioned before, flu happens in our summer in the southern hemisphere. And because they were taking appropriate COVID precautions, mask wearing and social distancing, there was actually a lesser impact of flu in those countries, that particularly those that took the COVID situation seriously and helped diminish that transmission by using the same methods we're recommended to use for COVID: masking, social distancing, and washing of hands. And with that, I am finished. So thank you all very much. And there's some questions. Wonderful.
Yeah. So Dr. Crawford, especially in the midst of the COVID pandemic that we have now, current recommendations for flu vaccine for someone who may have recently had COVID, those providers are indicated to wait at least a 7 to 10 day time period.
Right.
Symptom free and no fever before receiving that vaccine. Is there any other guidance that you would have for that?
No, that's very good to make note of, that if you've had COVID, when do you get the flu vaccine? And it is recommended that you wait about 7 to 10 days following the first symptom onset before you get the flu vaccine. Obviously, if you're seriously ill, they recommend waiting till you've in a recovery phase for that. Say you're still in the hospital and still, unfortunately, those that are very seriously ill can be several weeks. But I would certainly recommend that those who are in the recovery phase get it, because then if they're recovering and then they get the flu on top of that, it can be devastating. So I appreciate that question.
And to kind of understand that even a little bit more, is not necessarily that just because you're ill that the flu shot would make you even more ill, but that really giving your immune system to respond appropriately.
Right. Yeah, that's the particular your body. One, you may be on medications that say you're in the hospital and you're on medications like prednisone or dexamethasone. Some people have mentioned that's actually an immunosuppressant, and some of the other drugs that are used may suppress your immune response, including the serious illness, so that if you get the vaccine, you may have a less robust response to that. And you're weighing risk benefits in this situation in regards to when to give it. And you don't know for sure whether your immune system's ramped back up at that point. But I would say if you're taking more than, say, on an equivalent prednisone, we'll just use that drug, which is a very commonly used anti-inflammatory immunosuppressant drug. If you're taking more than 1 milligram per kilogram per day, or more than 20 milligrams for most people, then you should wait until you can get below that dose before you take the flu vaccine.
In addition to the flu vaccine, I don't have a lot of knowledge.
Certainly.
Vaccination in general, and some of the core questions that I get that I just like to throw out there. What was the shingles shot if I haven't had chickenpox?
Okay. So the question is, I want to repeat that, should people get the new shingles vaccine called Shingrix if they have no history that they know of having chickenpox? Well, interestingly, the CDC, through a variety of epidemiologic studies, believes at this moment in time, most people 50 and older have gotten infected. Whether you know you got infected or not, if you do immunologic studies, nearly 99% of people are immune. So there's no need to do any pre-testing of those people for chickenpox antibodies. And so the recommendation is assume everyone has been infected, even if the only time you could even think about that is if, say, you were the bubble boy and grew up in a very isolated environment where you didn't truly have any exposure to others. Because chickenpox, unfortunately, is a very contagious disease and can spread very rapidly. And most people, even say you were an infant, you didn't know you got it. You may have gotten a few bumps When you're younger, you may not break out as much as when you're older. So you may have actually got it and your mom didn't recognize it, your dad didn't recognize it, but you're still infected and now you're immune. But you're also now at risk of shingles. So should you get the shingles vaccine at this time in the midst of everything else? And the answer is yes, you can. It's very important. And the most important reason to get the shingles vaccine is not to prevent shingles, but to prevent the post-shingles pain syndrome. It has a fancy long name, but we'll just call it the post-shingles pain syndrome. It can last months, and it can be exceedingly painful, and there isn't any cure. There isn't any great treatment. It's just time, and it can make people miserable. In my practice, I have two populations. One of people who know somebody who's got the shingles and ones that don't. Those that know somebody who's got the shingles beg to get the shingles vaccine. Those that don't say, well, why do I need it? Well, I'm going to tell you, talk with somebody who's had shingles and they will convince you should get the vaccine because it's very, very effective. They believe it's going to be long lasting, takes 2 shots, 2 months apart, and I would certainly encourage it. I got it. It does cause a little bit of reaction for a day or two. It actually makes you feel like you have the flu for a day or two, not with a cough, but just with achiness that can be treated with Tylenol or acetaminophen or ibuprofen for a day or two.
I have a question too. Unfortunately, a lot of individuals might not be real clear on exactly what vaccines that they've had in general.
Certainly.
And so sometimes I've even encountered patients as well that maybe have 2 of the Prevnar or 2 of the other.
Right, the Pneumovax.
Is that detrimental in any way or okay?
Sure. The question is particularly regarding the pneumococcal vaccine. The pneumococcal vaccine is being promoted by a lot of people. There are 2 types of pneumococcal vaccines. One's called Prevnar 13, and the other one's called Pneumovax 23. The numbers have to do with the number of strains that are in those, and they do overlap a little bit. The Prevnar was actually brought out many years ago to primarily protect children from a type of meningitis that or brain infection that can occur, but it also protects against other types of pneumococcal disease that can affect the ear and the lung. And it's shown great success in children in preventing those particular diseases. Because it showed such good success, they decided that we needed to test it in older adults to see if we could protect our older adults from, unfortunately, the pneumonias and meningitises and blood infections that are due to the same bacteria, the pneumococcus, that was affecting children. We had an older vaccine called Pneumovax that had been used, and it was modestly effective. They increased the number of strains. That's why it's now called 23. It was originally, I think, 12. But they've increased the number of strains that are covered. And it is now recommended that all those 65 and above get the Pneumovax one time if you're otherwise healthy. There are other reasons to get it when you're younger than 65. And the question is, if you've gotten the Prevnar and say you get to a hospital and you get admitted for some reason because they really push it there. If you go to a pharmacy, they push it and can we give it to you? And you go, sure, go ahead. There isn't any great risk to getting multiple Prevnar vaccines. There are, though, with the Pneumovax. I would recommend it's not a big deal if it's 3 or less. But if you get more than that, it can cause, interestingly, a diminished immunity from that vaccine, repeated pneumovaxes. So it's recommended that we not repeatedly give that. Again, the recommendation currently is those who are otherwise healthy get the Pneumovax one time at age 65 and have a discussion with your doctor about the Prevnar vaccine. And if you're at maybe increased risk, consider getting that first and repeating the Pneumovax a year later. If you have some health risks, such as you're immunocompromised for whatever reason, you get the Prevnar early, before 65, anytime before that one time. Never have to repeat it. But you can repeat it. The Prevnar, and what's different about those two, interestingly, is the Prevnar is an adjuvanted pneumococcal vaccine. It's called conjugated, but it's the same idea. They add a chemical to it to enhance the immune system, whereas the older vaccine, the Pneumovax, isn't adjuvanted, and because it isn't, it doesn't, if you do it repeatedly, it actually diminishes the immune response. Yes, ma'am.
Okay, so, someone who was concerned about the flu vaccine and the
COVID vaccine? COVID. Thank you for those. So the question is there any risk to taking the COVID and the flu vaccine if you say get it at the same time, or you get your flu vaccine now and later getting the COVID vaccine? At the moment, there's no known contraindications to those particular issues. Again, though the COVID vaccines are under investigation, we don't yet have an approved, even under what's called the emergency use authorization, for any COVID vaccine at this time. There are plans, obviously, there's lots of studies going on, and it appears very positive that those people are developing immunity, or at least antibodies. We don't yet. The other thing that they're waiting on is getting people exposed and seeing if they are protected, even if they develop the antibodies. Those are the two issues. I would predict that there won't be any vaccine-to-vaccine interaction that would be detrimental to anyone's health in that situation. But it's certainly something to be watchful for. I would say we would get good advice on that. I trust the people that are at the FDA and the CDC and the World Health Organization to not approve those vaccines until they're ready to be released. And I'm going to be getting it. I'm going to recommend all of my family get it, and anyone who asks me. Now, there may be contraindications, but I believe that they'll be very limited. Now, do know that the vaccines will be rolled out in a stepwise fashion. They're going to be going to those at highest risk first, such as people who are working in high-risk healthcare situations, those that live in nursing homes or congregate facilities that we talked about with the flu. And then we're also then going to go to the next high-risk groups of people, such as people who aren't, say, over 60, but have other health risk, who may work in other congregate like schools. And then the third group will be the general population. I do think this is critical for us to consider that this is an important issue on national security, that we as a nation protect ourselves from this particular virus, because we need to be healthy, need to get back to our business. And that's the reason why, again, the 3 W's are still going to be important, and that's wearing masks, the distancing, and washing hands. Even if once we have the vaccine, I still think it's critical we still follow those rubrics to protect ourselves and others to help improve our economy. There's actually a study in Forbes that showed that if everyone wore a mask, we would actually increase our GDP in the nation. And so I think it's a national security issue that people wear masks to protect others. It's not just protecting themselves, but more importantly, it's protecting others. All right. Well, thank you all very much. I appreciate this. If anyone has any other questions when they're watching this, you can send those to the folks here at Healthy Living OKC, and I'd be happy to try to answer those for you. Again, stay well, wear your mask, wash your hands, and be socially distanced.